Dr. Marcia here, and today I want to talk about something a little bit different. I want to talk about what's been going on in the last several days, mostly across the United States, but also in Canada. We're talking about the death of George Floyd and the protests that have been going on. And it's a really important topic because it reminds me of how, for a white person, I take so much for granted. I take for granted all these things that, a person of color could not take for granted. For example, I take for granted that I can walk into a store and no one's going to be following me around wondering if I'm going to be a thief. Or I take for granted that if I commit a misdemeanor, it won't escalate into violence if the police are called. And I also take for granted that I'm going to get a good quality of health care. And one of the things I wanted to address today is the discrepancy between health care in different populations. And studies have been showing that people of color, especially Black people, receive substandard care compared to white populations. And we can see how in the COVID crisis, people who have been adversely affected have been populations of color. The death rates have been higher in communities that are racialized. And it's very important that we understand this fact because there are many issues involved with that. But what I want to talk about today is how, as a white person with privilege, I take for granted that I'm going to get excellent quality health care. But for people who are not white, the quality of health care is not exactly the same thing. And I want to talk about a patient of mine who is a young woman of color. And she had a situation where she developed fibroids. And 10 years before she received adequate treatment, she first went to the doctor. And the doctor said to her, this is her quote, that 50% of Black women live with fibroids. And my patient responded, well, I'm one of the 50% who can't live with the fibroids. I'm in severe pain. And the doctor responded to her, according to my patient, well, there's nothing I can do for you. And this began her 10-year journey of trying to get the proper care for her fibroids. She went to doctors over a period of 10 years, and every time she was turned away and told that there was nothing that they could do for her. Until her fibroids grew to 30 pounds. She was carrying 30 pounds of fibroids within her uterus and outside of her uterus. And finally, she found a new GP and was able to convince this doctor to send her to a specialist, and the specialist was able to book the surgery and have the fibroids removed. This poor woman was in so much pain. She said her bladder was flat like a pancake. And it took her 2 hours in the morning to relieve herself because her bladder had been so compromised by carrying around all this weight, all this pressure on it for 10 years. So we were in group one day, and this is how the story came out. One of my patients, a white woman, was talking about how she was booked for some elective surgery, some preventative surgery. And the young woman, the Black woman, was saying, how long did it take you to get this surgery? And the white woman said, oh, the first time I went, we booked it right away. And then two other white women said, oh yes, we had the same experience. We went, and on the first visit, we were booked for our surgery. So the Black woman went, wow. And she told us this story in the group. And it was very, very telling and very, very sad because it seemed to me like the only difference between one woman and the other three was the color of her skin. And these are things that we take for granted. These are things that as people who are white and who have privilege, we take for granted that we'll go into the doctor, we'll tell them our problem, we'll be taken seriously, and the appropriate treatments will be instituted immediately. But for my patient who is not white, she spent 10 years fighting to get the treatment that she needed, and that really should have been scheduled on her very first visit to the doctor. So in this time when we're talking about George Floyd and we're talking about how white people need to wake up and recognize their privilege and recognize all the things that they take for granted, I wanted to share with you today this story just to put into perspective the discrepancies in healthcare that people of color versus white people receive, and to give you a sense of how painful it is for some people trying to get the care that they deserve and that really everyone should be receiving. Please stay tuned for more videos on the topic of COVID and other topics as well. Stay safe, keep your hearts open. See you soon.